Welcome to the I Am You podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. Welcome to another episode of I Am You. If you are new to this podcast, welcome. In this podcast, we are sharing stories of women that have been in a journey through a healthcare system that doesn't see us, ignore us, and treat us like we are just little men. And today, I'm very happy and delighted to have Ms. Stewart here with us today. Ms. Stewart, welcome.
Oh, thank you so much. It's my pleasure to be here.
I know that you are busy, and I know that not only you had to make time to be here and join us today, but also it's not necessarily fun when we had to talk about medical problems and healthcare. And I realized that you have decided to come here and accepted this invitation for the purpose of helping other women save their lives. And I am so grateful for you. Thank you for being here.
Oh, absolutely. Thank you for inviting me. I appreciate it.
Okay. So when you and I met, which this relationship is been a very short, but click immediately, no? So you came to my office to get evaluated for your heart.
Yes.
But your journey started before you came to see me. And the reason why I thought that your story was so important to share is because your life, what you do, stress, and there was a point when you were not feeling good and you were attributing a lot of those symptoms to your stress life, which the audience, I'm pretty sure that 95% of the women that are listening to us can relate that sometimes stress can be pretty intense in our lives, and we justified a lot of the things, how we feel and stress. But also, you also have been through an accident and you were experiencing symptoms that somehow you related to the accident. But I'm gonna let you tell the story so the audience understand how is it that you end up in a cardiology office? Why did you end up seeing me?
Okay. So 5 years ago, I did have a car accident, neck and back injuries. So I was seeing a chiropractor. But I've been fine. But all of a sudden, back in March, I was having extreme pain in both the shoulder blades and in between my shoulder blades, which was kind of unusual. It wasn't the same pain I'd had before, but I didn't know where else to go. So I went to my chiropractor. And this was a 6-week journey with this pain being so intense in both my shoulder blades. And it was like the pain was moving around my whole back. It was just really weird symptoms. So went to the chiropractor like 4 times and it wasn't getting any better. So I thought maybe it was the way he was adjusting me. So the pain was like in the center right here, radiating all the way to my back. So I started thinking, okay, you think of that C word. Do I have cancer? Do I have a tumor? What's going on here? So my friends, you know how our friends are doctors. So my friends started saying, Sherry, you need to get an MRI. So I thought, okay. Also, the stress was because I didn't have a primary care at the time. My primary care doctor of 23 years decided not to take my health care insurance. So I had to wait 5 months to get into a primary care doctor. So I'm in between, so I don't have a doctor to write this order for MRI. So I'm thinking, what am I going to do? So stressed out. So I checked my blood pressure and it was very high. So the next morning I went to urgent care, and then I had chest pain also, but I was really in denial. I thought, this is just stress in my life. So I thought, so I even said to the doctor, it's just mild discomfort in the chest.
Was that true?
Yeah, but it was pain, but I was trying to,
minimize it.
Yes. So I said, so they checked my blood pressure. It was high. It did a EKG. It was abnormal. And I said, oh, well, that's no big deal because it's just stress, So they put me on some blood pressure medication. And I'm thinking, do I really need this? It's probably because sometimes when you go to the doctor, your blood pressure goes up. So I started the blood pressure medication, not having a doctor to go to, so I continued to go to the urgent care. And then they told me, you need to see a cardiologist.
Okay, before we go there.
Okay.
So a few things that I want to highlight for the audience. Number one, pain between the shoulder blades. Yeah, so that is a typical site for heart disease. When a woman is having heart problems, that's where the angina normally shows up, is going to be pain between the shoulder blades. But we don't know that. And if we don't know that, we can have pain between the shoulder blades and think about the motor vehicle accident that happened 3 years ago. So why now I'm having pain in between my shoulder blades? And heart will kill you if you don't attend that. And in your case, you went to see the chiropractor and the discomfort wasn't going away because it wasn't a misalignment. It was not an adjustment problem. But you still were thinking, oh my God, whatever he's doing is not working. He's probably not doing it right. No, so we are spending time going through therapy, not only thinking that this was musculoskeletal, but not knowing that there might be something else. Now, second thing, you mentioned the C word. Like, of course, we don't want to say cancer. Yes? And you worry at that point, even when you were having chest discomfort, because when you said went to the front and then to the back, so for the audience that are listening to this but they're not seeing us, is like it was the chest discomfort that went to the back, typical, of course, for heart problem as well. And even at that point, you were still thinking cancer before you think heart disease.
Yes.
No? Which happens to 99% of the women. We all think about cancer before we think heart disease. And we all worry about cancer more than we do about heart disease. We worry about dying from cancer more than we worry about dying from heart disease, even though, number one, more women die from heart disease than that they die from cancer.
I didn't know that.
And for every woman that die from cancer, 6 will die from heart disease. So if you take a group of 10, the majority of the women will die from heart disease, but we still are more worried about cancer. You were going to go for an MRI to see if you had cancer. But then in the urgent care, they go, you got to go and see a cardiologist. Was that because your blood pressure was still not responding to the therapy, or because you were still having on and off the discomfort, or both?
Well, both. And then also, I think because the abnormal EKG, which I blew that off thinking, well, that's just because, high blood pressure. So, and then also, I was starting to have discomfort. I call it again discomfort when it was pain on my left breast behind my nipple, and I thought, oh, okay, that's a lump or something. But I just had
one more time.
Yes, one more time. And I'm just like thinking, what? I just had a mammogram. It was normal, negative, for cancer. So I don't know what's going on here. And then the urgent care doctor even said to me, Sherry, you keep relating this to stress. And I said, well, I have a very stressful job. And he's like, but you're in denial here. There's some issues going on. You need to see a cardiologist. So I'm thinking, okay, so I tried one in Leesburg. I just want to say I kept trying the office. They would not answer the phone. So I physically went to the office. And when I got there, they said, we don't do appointments today. You'll have to come back next Tuesday. So that was a little red flag for me. So I'm thinking, maybe this isn't the cardiologist to go to, but I don't know anything about a cardiologist. Where do I go? So I asked three of my friends from church said, you need to go to Dr. Alvarez. That's where you need to go. And I'm like, well, who is she and how do I? So anyways, got on the website. Your staff is amazing, honestly. They were so easy to work with, the paperwork, just like that. I got an appointment and everything. And then I did all the tests that you recommended, which I'm thinking, what is going on here? So then when the stress test, I did the 100%. I'm like, good.
Said ace it.
I aced this. I don't really need a cardiologist. But then she said, she was so kind. The nurse said, now Sherry, just because of this, she may see something on this report and call you. And I'm thinking, she's not going to call me. Sure enough, I got the call.
that your test revealed that there was something wrong.
Yes.
And that we wanted to do a more invasive testing to try to understand why is your heart lacking enough blood flow. And of course, when you shared the story with me that you said, I got 100%, and you're like, I'm done with this.
Yes, exactly.
And I said, well, it's a good thing that you got there, but the test is revealing the heart cannot handle the stress that we're putting it through. So we did a coronary angiogram. That is that test where we go inside the heart to look for blockages. It also helps us understand the mechanism of your angina and the mechanism of the abnormalities of the heart. If it's blockages, we can fix them with stents. If it's not blockages, then we will use medical therapy to help the patients. But in your case, you have major blockages. And you have blockages in arteries that are super, super important, in which a heart attack could have cost you your life. And of course, God sent angels your way. No? It was kind of like
along,
when
yes.
that provider in the urgent care said, you are in denial.
Yes.
You got to go. No, it's like you are like you, many of the women in our audience are using stress as an excuse for their symptoms. And I think that if your story is going to be valuable for something, which is super valuable for so many things because we highlighted so many good points, but is stop using excuses until you know you don't know.
Yes.
Yeah. So, yes, stress can take a toll in our health, but it's not going to kill you. But if it's your heart that is the one giving you the symptoms, it can kill you.
Yes.
So don't be afraid. Go and get checked, get the answers. And when we tell you it's not your heart, then we can start looking for, okay, so what else can I do to help me feel better? So were you grateful that you decided to listen to your urgent care doctor and came to see a cardiologist?
Yes, and I'm so glad I found you because I'm telling this whole denial thing, even in the procedure when you told me I had blockage and you were going to take care of it, I'm still thinking, blockage? I've got blockage? I can't have blockage. There's no heart disease in my family. So,
and that's actually a very good point. Another thing that makes us feel like it cannot be me. Like we worry about cancer, we have a family member that had cancer.
Yes,
no?
yes.
And then although we know that there is a component of genetic in heart disease, it can start anywhere. No, it doesn't have to be that your mother and your grandfather and your aunt and your uncle had to have heart disease. It's like, well, I guess I'm the first one that now heart disease. And there's many factors. You are a postmenopausal woman. No, so menopause increase our risk of heart disease dramatically. And actually that plays a more significant role than our own genetics. So when you're thinking like, but I don't have family history, and I don't want the audience to think, oh, because in my family there's no heart problems, I will not have heart problems, because it's more complex than that. Again, age alone, that you should start thinking. If you are a woman that is listening to this podcast today and you are already in the perimenopause in the ages of 45 to 50, if you are postmenopausal, please know that your risk for heart disease increases dramatically through that process. So you should get checked. If you don't have symptoms, don't wait until you have symptoms, just get checked. But if you're having symptoms, please, please, please get checked, because it can be your heart. No, so for you, you just say it. I was saying in the table, with me doing the procedure, looking at the arteries, I said, you have a major blockage. And you're like, but how is that even possible? Well, it's there. So we're going to take care of it. Yes?
Yes.
So so then we went through that, and now we're working with some medications to kind of like optimize your overall care. But now knowing gives you the power not only to take care of yourself, live a healthy life, but also listen to your body better. And now you know what to listen to, what to look forward to.
Definitely, yes. And plus, Dr. Alvarez, honestly, I'm overweight too. I mean, my doctor's been telling me you need to lose weight. So I kind of contribute all this to the weight too, but I thank God and I thank you, because honestly, with those blockages, I could have had a major heart attack or something. And, so I'm just very thankful. And not only that, I'm 70 years old and I work full time and I work a lot of hours. So I was at the point I talked to my husband and I said, maybe my age and this stressful job, I just need to retire. But I feel like God called me to this ministry, and in my heart, I'm not ready to retire. But honestly, I would get home from work, working long hours, and I would just go straight to bed. I was so extremely tired, so exhausted. But I thought it was the work. I thought, Sherry, you're getting old. Most people are retired at this age. You need to retire. But I didn't want to. But I'm understanding now because of the blockage, that's why I was so tired. And honestly, I feel 10 years younger. I feel amazing.
So now we're gonna have you for many more years
Yes.
working. So you actually mentioned a few things that's what I love that you're here today. Listen to what you just said. I was assuming that I was exhausted because I'm old and I'm still working, but I love my job so bad because I feel that I was called by God to do this.
Yes.
And then fatigue, one of the common
Yes.
symptoms of heart disease in women. Shortness of breath. I am having back pain. I'm having this indigestion feeling that has nothing to do with, I didn't eat anything. I just get this indigestion. So for women, it's so different that we don't put one and one together and said this equals heart. You were taking it as isolated event. My back pain is my motor vehicle accident. My tiredness and fatigue is that I'm working too hard. I'm just too stressed. And you even use your weight as an explanation
Yes.
to why you've been feeling the way you're feeling. And yes, although weight can contribute to some symptoms, inability to exercise without getting short of breath, yes, perhaps. But weight is something that is not going to kill you. If
Yes.
your heart is in trouble, that's going to kill you. So let us find out first, is this something major or this is something that we can work with? And you didn't gain weight in 1 week.
No.
Or in 3 months.
Yes.
This is a process that has been ongoing. So why now is your weight an explanation to your symptoms and why they were not there 3 months ago? So for the women that are listening to us that are using weight as an excuse to why are they short of breath, why are they feeling tired, why are they feeling the way they are, I think that your story should invite them to get checked, know for sure. If it's your heart, take care of it. And if it's not, then we can help you lose weight.
Yes. Well, even when I was at the urgent care and he said, the stress and everything, and I'm thinking, and I told him about the chest pain, and he said, okay, women's symptoms are different than men. We want to rule out that you're not having a silent heart attack. And I said, well, I don't know what that is, but I can tell you I'm not having a heart attack. So total denial. I'm just saying.
Will you also, okay, let me rephrase this way. Were you in denial because you didn't want to accept the fact that you might have a heart problem, or you think that you were in denial because of the lack of information about this could have been your heart? Like, did you basically you didn't know that most of the symptoms that you were having were your heart? You were not aware of it.
Not at all. I never dreamed that I needed a cardiologist. Why would I need a cardiologist? I've always been healthy, but thinking back in January when I went my last visit with my primary that no longer was taking my insurance, my blood pressure was high, and she said, "Oh, wow, Sherry, this is unusual for you that your blood pressure is high." And I thought, "Oh, it's not a big deal." So when I think back, it started even back further. So there were signs all along the way.
So if we think that we are immune from heart disease, and when I say we, I mean as women, I want for people to know that the statistics speak otherwise. No, so we continue to bury more than 300,000 women every year, precisely because we don't recognize our symptoms. They don't know what to look for. And that is the purpose of this podcast. So we can actually not only empower them to seek medical attention, not only empower them to speak up until they get an answer, but also, what is it that I look for? Like, I don't know. And that was the purpose of the documentary. That's the purpose of the book, Heels versus Ties, is so we can educate our women. Our symptoms are different. Our risks are different. And they're like you, again, many, 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 many more women are out there saying, no, heart disease is not going to be my thing. And then I will tell them, if you worry about cancer, I can guarantee you that you have more chances of dying from your heart than you are from cancer. Wow. So if you get your mammograms, please get your heart checked.
Yes, definitely.
So this was such an amazing, amazing interview. I actually am so grateful for your charisma and so grateful for your honesty. And I'm so grateful that we were able to help you recover your quality of life.
Thank you so much. I appreciate you so much, more than you'll ever know, Dr. Alvarez. That's why I had to show up today. I'm like, I've got, I really feel like you saved my life, because I was headed in a very bad health situation, I think.
And I'm glad that you listened to your providers and the angels that God put in your way, and we are all instruments, and I'm very, very grateful for you today. Thank you.
Thank you.
And this takes us to an end of another episode of I Am You. Thank you for joining us. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode, and don't forget to follow us on Instagram and Facebook at NITZAMD. To explore more on this and related topics, visit our website, NITZAMD.com. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.